last case, we have two speakers. So last case is Alex. She's 25 years old, primary gravida, who is attending your clinic for first antenatal consultation. So you advise both pertussis and influenza vaccination during pregnancy. But she has been advised by her family to not be immunized because they do not believe this vaccine are effective or safe. Her nephew, 18 months old, recently had a pertussis vaccine and developed extensive swelling of the arm, and family are concerned that she will have a similar reaction because vaccine reaction runs in the family. I think it's a very similar, people probably recognize this. So the first speaker for this is Mrs. Lyn Langley. I think majority of people know Lyn. Lyn has been around over 20 years. I have no, maybe not that long.
Yeah,
I'm known here for a long time. As you all know, she is the obstetric GP shared care coordinator at Women and Children Hospital. But I'm sure you can call her for any other questions as well. I'll pass it on to Lyn.
Okay, thank you. Clearly not as interesting or exciting as Peter's previous presentation. However, one that is important in the community and for pregnant women. So bear with us. So we're going to be doing this quick, and we've skipped influenza pretty much altogether. We're just going to focus on pertussis. So pertussis, is commonly known as whooping cough, is a highly contagious infection of the respiratory tract caused by the bacterium Bordetella pertussis. Despite long-standing immunisation programs, pertussis remains highly prevalent in Australia, the least well-controlled of all vaccine-preventable diseases. In Australia, pertussis epidemics occur every 3 to 4 years, the most recent being between 2008 and 2012, the worst since national reporting began in 1991. So the background, as you would all be aware, is pertussis is a highly contagious infection, which is most severe in young babies. Pertussis is most common among babies younger than 6 months old, and about 9 in 10 young babies who get pertussis will require hospitalisation. Those less than 3 months old are at most risk of severe disease. Babies at this age who get pertussis, 1 in 200 will die. 80% of these babies get pertussis from their parents or their siblings. So we are all aware of symptoms, and not everybody gets all of the symptoms. Common cold-like symptoms including runny nose, sore watery red eyes, low-grade fever, tiredness, general unwellness, and a mild or occasional cough. However, these symptoms are not present in all people, and over time coughing spells become more severe. Coughing can last for several weeks, sometimes 10 weeks or longer. Symptoms appear within 7 to 20 days of exposure, and people are infectious up to 21 days after the onset of symptoms. And we talked about the epidemics. So the current recommendations are that our pregnant women have a single dose of pertussis vaccine in the 3rd trimester, preferably between 28 and 32 weeks gestation. That's ultimate. It can be given any time in the 3rd trimester up to delivery. Obviously, it depends when they present or when they get the information to make their decision. Antibody levels peak 2 weeks after vaccination. Active transport of maternal antibodies to the fetus occurs predominantly from 30 weeks gestation onwards via trans-placental transfer. Hence, the reason they've done this is to capture our little people that decide to come a bit early. Vaccination of others who will be in close contact with the baby called cocooning is still recommended. This is what we did prior to starting our vaccination program. So those that have the adult contact with these children, babies need to cocoon. That means any adults within contact. The vaccine administration is a 0.5 ml administered intramuscularly of the adult pertussis vaccine. It's only available in a combination with diphtheria and tetanus. A lot of people just call it whooping cough. We need to think about diphtheria and tetanus because not only of these women get recurrent vaccination with diphtheria and tetanus, we do have some individuals in our community that are actually allergic to diphtheria and tetanus. Compared to the DTPA is compared to the childhood vaccines, which the children's has a reduced diphtheria and tetanus antigen. So vaccines are available in Boostrix and Adacel. So you might have some of your women having either of those. The contraindications, the only absolute to acellular pertussis containing vaccine is anaphylaxis from a previous dose of any acellular pertussis containing a vaccine and anaphylaxis following any vaccine component. Side effects are localised reactions, as for any vaccination. They occur rarely, they commence within 48 hours of vaccination and last from 1 to 7 days, and they resolve completely. Fever, malaise, myalgia occur commonly and can last up to 2 days. Swelling, redness, pain and itch and site, that is common localised reactions. So I guess the take-home messages are, where can they get it? Doctors, clinics, community health centres, local council, immunisation clinics, Aboriginal health centres and our metropolitan maternity hospitals. Early short-term protection is critical for these babies. Babies will not get their first whooping cough vaccine until they're 2 months old. By making a strong vaccine referral, you can ensure that your pregnant patients receive the recommended vaccine if you're unable to administer it to them yourself. Boosted dose of pertussis vaccination is recommended for adult close contacts if they haven't had a vaccination in the last 10 years. As healthcare workers, we should be having vaccines boosters within 5 years. So I don't know how many in your audience are up to date with your whooping cough vaccine. Good, thanks Celia, good girl. And when you think of organisations such as the one I work in, we can only get less than 60% of our health workers to do influenza. So, you know, you need to think about your duty of care. Are you up to date? Have you protected your patients? Have you had a recent flu vax? Have you had your whooping cough? Live attenuated vaccines are the only type of vaccines that are not able to be given during pregnancy, like your MMR. Pertussis vaccine is only available in Australia in combination with diphtheria and tetanus. And I don't know if all of you have actually experienced whooping cough or heard it or seen it, because it is quite specific. Got a little audio if it works. Is it going to work? Maybe. It's all right, only goes for 20 seconds. So if we go back to the case study, which Morgan so kindly gave us at the beginning. So with this one, I think it's important as healthcare workers to, at times when you have the opportunity to dispel myths and challenge people's ideology really, as to, in this example, she's a primate, she's 25 years old, she's got lots of influencing from family members. The other thing is the nephew's 18 months old, so he, unless it's his first exposure to vaccine, he should have already had some vaccine, one would have thought, including the diphtheria, tetanus and the pertussis. With this one, with the DTaP and the IPV, it's actually got polio in it as well. So that is, which is what Professor Gould will talk about. Yeah. So it's actually different. So it's important to actually challenge these women about what they're saying, where they're getting the information from, so they've got informed decision to dispel myths as we go along.
Well, thank you so much.